In this video, we will be discussing the causes, symptoms, and ways to manage sleep paralysis. And if you stay till the end, you can learn about the different entities. Hey guys, welcome back to Brain Feed. Today, we're going to have a look at the world of sleep paralysis and the entities you might encounter. If you're new here, consider subscribing and leave a like. It's totally free. Now let's dive into the video and make sure to not fall asleep. So, let's start. What is sleep paralysis? Sleep paralysis is a phenomenon that affects many people, causing feelings of fear, panic, and even terror. It is a condition in which a person is temporarily unable to move or speak while falling asleep or waking up. This can be a very frightening experience and can leave a lasting impact on the individual. However, it is important to understand that sleep paralysis is a normal and common occurrence, and it is not a serious medical condition. First, let's talk about what exactly happens during sleep paralysis. During sleep, our bodies go through different stages of sleep, including rapid eye movement, REM, and non-rapid eye movement, NREM sleep. During REM sleep, our bodies are temporarily paralyzed, which helps prevent us from acting out our dreams. This is called REM atonia. Sleep paralysis occurs when the body is unable to move out of this paralyzed state, even though the person is awake. This means that the person is conscious but unable to move or speak. This can last anywhere from a few seconds to several minutes and can be accompanied by vivid hallucinations, including feeling a presence in the room, hearing strange noises, or feeling pressure on the chest. Sleep paralysis is often associated with other sleep disorders, such as narcolepsy and restless leg syndrome. It can also be triggered by a lack of sleep, stress, alcohol or drug use, and changes in sleep patterns. One of the most common symptoms of sleep paralysis is feeling a presence in the room, often described as a dark figure or entity. This can be frightening and can lead to feelings of fear and panic. However, it is important to remember that this is a hallucination and is not real. Other symptoms of sleep paralysis can include feeling pressure on the chest, difficulty breathing, and sweating. In some cases, the person may also experience vivid dreams or nightmares. While sleep paralysis can be a frightening experience, there are ways to manage it. The first step is to maintain good sleep habits, including getting enough sleep, avoiding alcohol and drugs, and reducing stress. This can help reduce the frequency and severity of sleep paralysis episodes. Another helpful strategy is to change your sleep position. Sleeping on your back can increase the likelihood of sleep paralysis, so try sleeping on your side instead. This can help reduce the pressure on the chest, which is one of the main causes of sleep paralysis. It is also important to create a relaxing sleep environment. This means reducing the amount of light, noise, and distractions in your room. A comfortable mattress and pillow can also help improve sleep quality. If sleep paralysis is causing significant distress, it is important to talk to a doctor or sleep specialist. They can help diagnose and treat any underlying sleep disorders and offer additional strategies for managing sleep paralysis. During sleep paralysis, people often report encountering various entities that can be perceived as frightening or frighteningly real. These entities can take different forms, such as shadows, ghosts, demons, aliens, or even a perceived intruder in the room. While these entities can seem real, they are not actually present and are instead a manifestation of the person's subconscious mind. These experiences can be accompanied by feelings of fear, anxiety, and a sense of pressure on the chest. So, now let's have a deeper look at these entities. The Old Hag is a commonly reported entity encountered during sleep paralysis, particularly in cultures with a tradition of supernatural beliefs. The Old Hag is often described as a witch-like figure that sits on the chest of the person experiencing sleep paralysis, making it difficult for them to breathe or move. This experience can be accompanied by feelings of intense fear and a sense of a presence in the room. The appearance of the Old Hag varies, but she is often described as an elderly, haggard woman with wrinkled skin, long hair, and a wrinkled face. She may also be depicted as having a frightening or evil expression and wearing dark, tattered clothing. Some people report that the Old Hag has physical features that are distorted or elongated, such as a hooked nose or elongated fingers. The appearance of the Old Hag can also be influenced by cultural beliefs and personal experiences. In some cultures, the Old Hag may be seen as a sinister or malevolent figure, while in others she may be viewed as a mischievous or harmless entity. Despite these variations, the Old Hag is typically depicted as an unsettling or frightening figure that is associated with sleep paralysis. Other entities that people describe are shadow people. Shadow people are entities that are often reported during sleep paralysis, as well as in other types of paranormal or supernatural experiences. They are typically described as dark, shadowy figures that lack distinct features that are seen lurking in the background or moving across your field of vision. Some people report that shadow people have a humanoid shape, while others describe them as shapeless or amorphous. Like other entities encountered during sleep paralysis, shadow people are not considered to be real beings, but are instead thought to be a manifestation of the person's subconscious mind. If you experience the Old Hag or any other entity during sleep paralysis, here are some things you can do. 1. Try to stay calm. It can be frightening to experience sleep paralysis, but it's important to stay as calm as possible. Try to take slow, deep breaths and remind yourself that this is a temporary experience that will soon pass. 2. Focus on movement. Try to wiggle your fingers or toes or move any part of your body that you can. This can help break the sleep paralysis and allow you to regain control over your movements. 3. Use visualization. Imagine that you are in a safe and secure place and surround yourself with positive thoughts and feelings. Visualizing a protective shield or a bright light can also help you feel more secure. 4. Engage your senses. Listen to music or focus on a specific scent or taste to help bring you back to reality. 5. Seek support. If sleep paralysis is affecting your quality of life, it may be helpful to seek support from a mental health professional. It's important to remember that sleep paralysis is a natural phenomenon and is not considered a sign of a mental health issue. So this is it for today. Did you ever experience sleep paralysis? Let us know in the comments below. If you like this video, consider watching some of our other videos seen on screen. Oh, and by the way, sleep well.